Oakwood-affiliated orthopedic surgeons, Dr. Angelo Sorsi, who sees patients at his offices in Canton, Dr. Lawrence Morawa, who has offices in Dearborn, and Dr. Abdullah Omari, who is based in Dearborn as well. Gentlemen, thank you so much for coming in and sharing some time with us this morning.
Thank you.
Thank you, Lloyd.
Dr. Sorsi, let me start with you. What are some of the most common causes of chronic bone and joint pain?
Well, Lloyd, in my practice, I see everything from sports or work-related injuries of the shoulder, hip, and knee, and those range anywhere from labral tears, impingement syndrome of the shoulder, or meniscal tears. But by far, the number one cause of chronic joint pain, as you mentioned, is arthritis. As you mentioned, it's leading cause of disability in the United States, currently at a level of 1 in 7, and by the year 2020, 1 in 5 Americans will suffer from this.
Dr. Omari, what role does lifestyle play in causing orthopedic problems? And can you change your diet and do some exercises to help kind of alleviate those issues?
Well, as you know, Lloyd, I mean, most of orthopedic problems are due to overuse, and especially lower limb. These are weight-bearing joints, so lifestyle is important. And, of course, obesity plays a role. So that's why we'd like to, as we say, keep an eye on your weight. And exercise is always what we say is the low impact rather than high impact. Because nowadays most of us would like to keep fit as much as able. And the low impact, such as cycling, swimming, rather than running on a daily basis, unless you have to as a professional sportsman.
Here's Dr. Morawa. If someone is experiencing some bone and joint pain, at what point is it time to say, okay, I need to go and get this checked out?
I think if they last longer than what expected, which is usually a short period of time, because many of the things that occur in a bone and joint area can be treated earlier, easier than if we wait long and it becomes chronic in character. So as we always tell our patients, the first thing we need to do is to make sure we make a diagnosis, and then based upon the diagnosis, the treatment plan can be developed. And we like to usually start with non-operative things if we can, medical treatment or weight loss or exercise programs. If people tend to wait, sometimes they get too far down the road and we have to do other things. So it's, I would say it's better to see people earlier than later.
So surgery would be like a last-ditch effort there?
Surgery is, for elective things, is usually the last thing we need to do. Obviously, in broken bones, that's a whole different thing from the emergency room. But
right.
For arthritis-type pain, we try to get them as early as we can and work on, rehabilitation from a standpoint of muscle strengthening, balancing of muscle groups, treatment with some medications usually, and things like that can prevent the further progress of the disease process and usually make the patient a lot more comfortable.
Dr. Abdullah Omari. Let's go to the phone line to talk to Kevin from Ontario. Kevin, what's your question this morning?
Good morning, Doctor. Over the last several years, I've noticed that my shoulders have started to hurt more and more, and I've just started to develop very limited mobility in them. And my general practitioner suggested that I might have a problem called frozen shoulder and suggested therapy, physical therapy, and I wanted to find out what frozen shoulder meant and whether I could expect physical therapy to help.
All right, Kevin, we'll get that answer for you. Dr. Sorsi?
Yes, good morning, Kevin. Frozen shoulder, let me ask you, sir, first, are you a diabetic?
No, I'm not.
Okay. And is it equal on both sides or one more than the other?
One more than the other, my right side, and I'm right-handed, but the left side's starting to catch up.
Okay. Frozen shoulder, also known as adhesive capsulitis, is a bit of a misnomer. Capsulitis signifies some sort of inflammation. There's actually a ligament called the glenohumeral ligament. It's in the capsule. And for whatever reason, we're not quite sure, this actually shrinks. I tell my patients it's much like that childhood toy from the 80s, a Shrinky Dinks. That will shrink hard and firm, and it decreases your capsule space. And usually non-diabetic population, a bout of physical therapy, your primary care physician is correct, but usually anywhere from 2 to 3 months of strict physical therapy, non-diabetic, up to anywhere from 4 to 6 in diabetic population. And we know that there is a correlation with, as I mentioned, diabetics, as well as those people who have cardiac catheterizations. We're not sure why. We believe it's perhaps the position of the shoulders when the cardiologist is performing the catheterization process. But this glenohumeral ligament becomes inflamed, and not necessarily inflamed, but chemically it changes. Physically it's changed, and it takes a tremendous amount to loosen that up. There is a surgical procedure, but usually we try a period of physical therapy to loosen what we can, and then we can go in with a scope and actually incise with the arthroscope part of the capsule and ligament to increase your range of motion.
I got a problem with my left hip. Sometimes, and I don't have a whole lot of pain in it, but I do have some. But if I'm like going up a step or something, it's like my left leg, my leg won't. It's like it's locked out, like it's out of position, like it won't allow me to raise my leg up, and I have to turn a certain direction to get it back straight again. And I just wonder if that's something I should be concerned about, or is just something. I'm 67 years old. Is it just old age, or what do you think?
Dr. Omari?
Good morning, Larry. We don't say old age, we say maturity to start.
There you go.
Okay. Now, if I may ask you some questions, where do you feel the pain? Do you feel it in the groin itself?
No, it's more like on the hip, where the hip.
Okay, on the side.
Yeah, and it goes more to the center. When it locks, it just won't let me pull my leg straight up to go up a step.
Okay.
I gotta turn and pull it back in, like it's jumped out of socket or something. I don't know.
Okay. Have you had any previous problems with that hip, or that's the first time?
No, it's happened quite a number of times over the last couple of years.
Okay. Do you suffer from any arthritis problem in any of the joints?
No more than normal. I did have back surgery. They told me I'd have arthritis when I got older, or got more mature. And I don't know if that's the problem, but nothing in my back or anything. It's just my left hip.
Okay. Well, it looks like, most likely this is what we call wear and tear or degenerative joint disease affecting the hip. And the first thing to start with is obviously non-operative measures. And these are, as we said, keep an eye on your weight, painkillers as needed, and physical therapy, and sometimes even using a cane if needs be. And have you got an x-ray done?
No, I really haven't.
That's the other thing to do, is get a plain x-ray, get you through your primary care physician, and then see what is the problem. And if these measures plus the x-rays confirm that is an arthritic, then things could be done. And one of the things we can help you, if it's not a florid type arthritis, we can try an injection to start with, or even a hip scope nowadays, and depending on the severity, then other modality of treatment could be considered.
It doesn't seem to it lasts. One day it does it, and then it won't do it again for another month or so. But it's just all of a sudden I can't pull my leg up to get up a step, or if I get off the sofa, I gotta turn my whole body to get my legs straight.
That seems typical of arthritis, where they usually go ups and downs, and certain change in weather and certain positions, they just get the arthritic problem in the joint where it catches and causes these problems. That's typical.